Hello, and welcome to the West Texas Health IT Regional Extension Center educational series. Our speaker today is Sharon Rose. She will be speaking about patient portals and patient engagement. All attendees have been muted to block out background noise. If you have questions for our speaker, please post them in the chat block of the GoToWebinar pane. Your questions will be read to the presenter at the end of the presentation. If we are unable to answer your question during the allotted time, you will receive an answer via email. First, some information about our speaker. Sharon Rose is a regional coordinator for the West Texas Health IT Regional Extension Center. With more than 30 years nursing experience, Sharon has worked in many different areas of hospitals, including medical surgical, ICU, ER, staff educator, and director of emergency department. Being interested in health information technology, she earned the HIPPO Clinician Practitioner Consultant certification. She has worked in Lubbock as a clinical application specialist, training nursing staff, ancillary staff, and physicians on meaningful use of electronic health records and preparing for attestation. Sharon continues assisting rural hospitals and providers in understanding and meeting meaningful use criteria. Thank you for joining us, and I will now turn over the webinar to Sharon. Sharon, the presentation is yours.
Thank you and good afternoon. Can you see my?
Not
Can you see my screen now?
not yet. Right there. Yeah, we can see it.
Okay. Okay. Thank you. Thank you for joining us today. And I know that you are all pressed for time, so we'll try to get through this presentation and have a little bit of time at the end to answer any questions you might have. So with the beginning of Meaningful Use Stage 2, when it came out last year, they changed their goals a little bit, and two of their goals was, one was to increase health information exchange between providers, but the second one, which is our main focus for today's talk, it was to increase patient engagement. So during the next 30 to 45 minutes, we're going to look at what a patient portal consists of, the benefits to the patients as well as the providers, options that are available, secure messaging, and the role the patient portal has in regards to meeting meaningful use objectives. So we're going to start with what is a patient portal. The patient portal is a secure online website that gives your patients convenient 24-hour access to their personal health information and medical records anywhere they are, as long as they have an internet connection. Healthcare-related online applications that allow patients to interact and communicate with their healthcare provider would be how they would send the secure messaging. And this patient portal may be a standalone website. It can be integrated into another website, or it's a module that is added to your EMR system. So the patient portal, at the least, is access the patient has to their personal health information. They should be able to access and view their information on a secure and encrypted website. So why do you, as a provider, need a patient portal? One of the goals for Stage 2 is to increase patient engagement. By enabling your patients to access their health information, the provider and staff can encourage them to become more actively involved in their care. The portal should be an avenue for your patients to send you secure messages regarding questions related to their or their family's care. At the minimum, the patient portal needs to be able to allow the patient to view, download, and transmit their health information and send secure messages to the provider's office in order to meet meaningful use objectives and receive incentive payments. So some of the benefits to a patient portal would be the features that these portals have to offer. The features will vary, and as I stated earlier, the least is for the patients to be able to view, print, and download their medical records, as well as send secure messages. The information sent to the portal can be managed, which we will talk about a little bit later on in this presentation. Enabling patients to send secure messages may have a twofold benefit. It may cut down on phone calls to the office, decrease the amount of time the provider uses trying to return those calls and playing telephone tag, and allow patients to get answers regarding care in a quicker, more convenient manner. It will mean another adjustment to your practice workflow, but by talking with your EHR vendor, portal vendor, or your REC member, they should be able to help educate you and your staff on the working of the portal and suggest changes to your workflow redesign. Some of the other features that may be available and which would improve patient satisfaction and activation include scheduling non-urgent appointments, updating contact information, completing intake forms, requesting prescription refills, and even making payments. These are other features that can be added at a later time, like once you get the portal going and get your patients utilizing the portal, they may request that some of these other features would be more convenient for them. And this is something that you can talk to with your vendors to find out more information regarding what these features entail and when and if they are available for utilization. So, when do you need this portal? Well, beginning this year, all providers and hospitals need to have a 2014 certified system, which most are currently trying to get updated and installed. With the introduction of Stage 2 came some stages to Stage 1 as well, which take effect this year. The Stage 1 core objectives for eligible providers and hospitals, which stated last year in 2013, electronic copy of their health information upon request. That objective has changed to provide more than 50% of patients the ability to view online, download, and transmit their health information within 4 days of information being available to the provider. With the hospitals, they have 36 hours in which to give them access after discharge. For Stage 2 objective, you have to have 50% of your patients provided the ability to view, download, and transmit, and actually 5% have to access their portal. For hospitals, once the patient is discharged, you can have a staff member take a computer to them, walk them through the process of accessing the patient portal, and that will count towards that 5%. For providers, some of the offices that we've talked to out in the field have thought about installing kiosks in the waiting rooms, or again, having a staff member to be able to sit down with them and walk them through the process. Of course, for smaller offices, that might not be an option. So we're going to have to get kind of creative and see what we can do to get that 5%. For Stage 2, providers need to have more than 5% of their patients send a secure message. So if you're still in Stage 1, you have time to really begin educating your patients and encouraging them to use this tool. For those of you in Stage 2, you and all your staff need to be positive and encourage patients to utilize the portal and send secure messaging. And again, you'll need to come up with some educational handouts, information that will walk the patient through how to use the patient portal to send your secure message. So what are some options that you have as a provider? There are some options available, but you need to be very careful with what you decide, because you know the old saying is you get what you pay for. Vendors have modules which will integrate with your system. There will be a cost, which may include software installation, annual maintenance, and per transaction. So you need to talk to your vendor to find out what the costs are and what features they offer and options they have. Another source is called an open source software. This is a free software provided and funded through donations and volunteers. You will need to be responsible to check periodically for new updates and make sure they are compatible with your current vendor software. At this time, the last time I looked online, the open source software, they were stage 1, meaningful use compliant, but they are still working on becoming stage 2 compliant and need donations in order to get there. Lastly, there are a lot of independent companies popping up out there that have designed their software to be compatible with most EHRs. However, they will still charge a monthly subscription fee, much like your EHR vendor. Of course, it is an open field out there with lots of players, so you want to make sure you get in writing what you will receive and the cost involved. Now for patient engagement. Learn and understand the elements of an effective portal program. You will need to make sure that you and your staff know about all the features the portal has to offer for your patients. Fears and other negative attitudes are often alleviated if you gain experience and see its benefits for your patients and your practice. Talk with your staff and come up with a plan to educate your patients about the portal and all that it has to offer. You can develop some talking points that you and your staff will go over with your patients to encourage them to sign up and use the portal. Developing step-by-step instruction sheets to give to your patients or email them to your patients is advisable. That way, when they're not in the office, instead of them calling and asking you how to access the portal, they'll have those instructions in front of them. You will need to advertise by posting signs in the office and exam rooms, and include adding a message to your phone system when they call in and they're placed on hold to remind them that they do have access to patient portals and that some of the information they may be wanting to talk to you about can be done through the patient portal. You may want to talk with your staff about after-hour calls. Are you still going to encourage them to use the secure messaging through the patient portal? If you do that, you'll need to have someone that's going to be available to answer those even through the night. So these are a lot of decisions that you and your staff are going to have to sit down and discuss and come up with a plan of action. Remember, since this is a new venture, you will need to develop policies and procedures about response times for answering messages and what the workflow for routing and responding to these messages will be. The biggest part is to get your patients engaged, and the best way to do that is by educating and answering their questions to the best of your ability. For secure messaging, this is a stage 2 requirement, and it's just another way to get patients to become more engaged in their health care. No matter what stage you're at, if you're currently attesting, you can start encouraging your patients to use it now. Some of the ways that it can be used for is to promote coordination of care between visits, handle routine health issues. Maybe they had a question about the treatment plan that they don't understand or that they couldn't remember what was said. They can send a message to ask that question. They can also use it for refills, and referrals can be addressed instead of phone calls, which will tie up your staff. Many times patients have questions or concerns about the new treatment, or even questions that they don't feel comfortable asking you in person, or that they just forgot to ask during their visit. Secure messaging is a great way to answer those. For your hypertensive, diabetic patients, for example, they could send blood pressures or blood sugar results through secure messaging, which could be advantageous because then you can make changes to their treatment plan prior to their next office visit, which would in turn aid in better blood pressure and blood sugar control, and both of these are quality measures that are being looked at by CMS at this time. So what are some of the benefits to your patients? Well, as you all know, going to a doctor can be anxious anyway, so sometimes they forget questions or just feel uncomfortable and feel pressured and don't remember to ask questions. So they could ask them through secure messaging. You can also avoid frustration, which will increase your patient satisfaction by having them do online activity once they get used to the system. Their satisfaction may go down in the beginning, but once they use it and get used to it, just like anything else in life, change is hard, but once they get used to it, it should decrease their frustration in trying to get answers to questions and get a hold of their provider by the telephone. And again, they will call and need to talk to you about a sensitive issue, and they just want to leave a message for you for the provider to return their call. But as good receptionists, we always ask what it's in regards to so that you can let the provider know what the issue is. But with secure messaging, they can avoid this awkward situation. And I know myself, I have a hard time remembering to request refills till the last minute. I always think about it when the office is closed. So by being able to send for refill requests through secure messaging, I can do it when I think about it, and then I can check back later in the day for a reply from the provider or the office. Again, you can share important information for managing health conditions such as your blood pressure and blood glucose. All in all, it can improve patient adherence to treatment, thus reducing readmission rates and uncontrolled health conditions. Benefits to the provider. I kind of mentioned this earlier. It will avoid delays in communication as well as miscommunication. You can avoid those telephone tag that you play with your patients. And sometimes when you get some of those patients on the phone, they've had time to think of other questions, and sometimes you get into a conversation that should have only taken 5-10 minutes at the most, now has turned into a 20 or 30-minute event. It's very inconvenient and frustrating, especially if you're trying to make a call between patient visits. It will also free up additional office visits and increase access to patients who need to be seen by being able to address routine health issues through secure messaging. It will improve your record accuracy, because how many physicians take the time to sit down and write out the communication that went on between them and the patient over the phone? Doing it through secure messaging, it automatically captures and documents that communication into the patient's record. It improves efficiency and saves time. because some questions can have auto replies that can be used for routine issues. Once everybody gets used to the process, it will contribute to patient satisfaction. So let's talk about some of the concerns and facts, which some I've even heard from providers. And these concerns and facts were questions on surveys which providers who had already implemented patient portals answered. The first one is providers will be flooded with email messages from patients. What was found was rather than being inundated with messages, providers reported increased efficiency and appreciate being able to respond to patients at their convenience. The studies did find that the telephone volume also decreased in the office when secure messaging was introduced. Another concern was patients may use messaging inappropriately, and I'm sure I could hear some of the wheels turning out there as I was talking about it, that they could see that happening. But the studies did find that the communication content of patient messages were appropriate. They did address non-urgent care issues. Best practice is to educate patients about when and how to use secure messaging. In the beginning, you may see a lot of inappropriate use, but as they get used to how to properly use it and continued education with your patients, that will improve. Another concern, clinicians will be unable to bill time for communicating with patients on the portal, and the practice will lose revenue. Portal features have been found to provide cost savings by decreasing indirect and direct labor costs, such as mailing costs for lab results, online billing questions versus telephone, online appointment scheduling, and online appointment reminders. So some physicians have reported seeing fewer no-shows because of the appointment reminders, and if your patients are able to schedule their appointments online, it can be better suited around their schedule when available. Patients will be confused or upset by information contained within the EHR. Best practice for displaying test results include providing a brief explanation and guidance for any follow-up along with the results. This is where you need to really talk with your vendor and find out how to use your system and how to display the tests with explanations along with those tests, especially for lab results. And last, patients won't adapt to using a patient portal. This I hear a lot from a lot of our clients. However, the majority of consumers favor using online tools to communicate with providers and view their lab results and make appointments. Medical practices have had success in getting a wide range of patients, including the elderly, lower income, and those with chronic illnesses, to use a patient portal. Because if you really think about it, how many of your patients, no matter age, socioeconomic, do not have a cell phone that can get internet access? So here's some more facts and results. A fellow coworker of mine did a poster presentation at the Crossroads Conference a couple of weeks ago in regards to patient engagement and satisfaction. So I borrowed some of her research, which I felt would be good at this point in time, because this is what we hear in the field. Our patients don't care about getting on the internet. Our patients are too old. Our patients don't use the internet. However, if you look at this study, which was done in 2013, just last year, it addresses a lot of these things. In the rural IT facts, 83% of adults use the internet today. And of course, you with young people in your household, 97% of use ages 15 to 19 use the internet almost continuously. 88% use cell phones, and 43% use smartphones as compared to the national average of 54%. So, as you can see by looking at these statistics, rural America is becoming more technologically advanced, and many of our children live in a tech world, so the IT gap is definitely closing. On a consumer report, 52% of consumers said they would switch providers in order to gain access to their records on an EHR. 4 out of 5 want full access. 36% have full access. 65% of providers only want to give partial access, and more than half of the consumers maintain some sort of health records online. Because for many years there have been websites out there where you could go and create an account and record your PHI, your family's PHI, and change it on a regular basis. By giving patients access to their records, they won't have to remember to go and update their information with their vitals, labs, or changes to their medications. They can just access their information via your patient portal and share it with family members as well as other providers, so that we start giving more continuity of care and eliminate duplicate testing. So how does the patient portal link to meaningful use? Educate and encourage your patients to utilize the patient portal to see their health information and share it with other providers. This is what I have been talking about. Instead of printing out clinical summaries, which so many of you had to do last year in order to meet that objective, you can now send them to the patient portal so that they can access it whenever they have internet connections. You will also, another objective is you will provide patients with the ability again to view, download, and transmit their information. The third objective is being able to send reminders to your patients. Communication, communication, that's what the game is now. You and your vendor should be able to show your staff how to set it up in order to send patient reminders for follow-up care. Providing education or links to education for your patients is another meaningful use objective. How many of you, or you know of your patients that search the internet looking for information regarding their health? Now you will have the ability to give the patients the information they need and the information you want them to read. And lastly, the secure messaging, which is a stage 2 objective, but you might as well go ahead and get started in stage 1. Remember, all of this does not have to be done today. If you're in stage 1, you need the portal available to your patients to access. Then you can gradually roll out the rest as they become familiar and start utilizing the portal. For those of you in stage 2, you need the portal and the secure messaging available for your patients to access this year. Some of the upcoming deadlines that you need to be made aware of in order for this year: for providers who have never attested for meaningful use or did not attest in 2014, July 1st is a very important date. In order to prevent Medicare payment adjustments in 2015, you must attest during the 3rd quarter. If you attested in 2013, you will not have any payment adjustments. But if you haven't attested yet, you need to attest. Start your 90-day attestation period July the 1st. which is the beginning of the third quarter. If your EHR, which we know there's a lot of them out there that do not have full implementation yet, if it's not ready, you can file for a hardship exception. But this must be completed and sent by midnight of July 1st as well. The second date to remember is October 1st of 2014. This is the day that you will need to submit your 90-day attestation. So if you're attesting for the third quarter of 2014, that 90 days runs from July 1st to the end of September. October 1st is the day you would get online and submit your attestation. Another deadline for October 1st is, if you're going to attest in 2014, October 1st is the last day to begin your 90-day attestation. And that will run from October 1st through December 31st. And January 1st would be the first day that you can submit your 90-day attestation. Another deadline for that is the end of February. You have until the end of February to submit your 90-day attestation for 2014. And now we'll open it up to any questions that you may have.
Thank you, Sharon. I do not see any questions.
Well, either I did a very good job or,
yes.
or so overwhelmed they don't know what to ask.
It was very helpful. Thank you very much. So, well, all the attendees, you know that if you have any questions, you can email us. And also, well, I want to thank our speaker for taking the time out of her busy day to share her knowledge with us. As I was telling, if you have any questions for today's presenter, you can email the email that is showing, the West Texas Health Information Technology rec email. And thank you very much for attending today's webinar.
Oh, Veronica?
Yes.
I have one more thing.
Okay.
On this slide that you're seeing now is our phone number for the West Texas Regional Extension Center, that if you need help with any of your meaningful use attestations or questions, you can feel free to call our office as well. And this is a list of services that we do offer. And also, I did want to mention that next month, July the 18th, the presentation will be what you need to know about PQRS. And I think that's all I have.
Okay, thank you very much for the information, Sharon.
Thank you.
Thank you, everyone. Goodbye.